Afternoon, New Mexico. I think we're ready to begin. I apologize for being a little late. It's Governor Lujan Grisham, and I know that this is not our typical day, although I believe many of you are very accustomed to hearing directly from Dr. Grace and Dr. Collins about COVID updates and also healthcare access updates, since it's now all COVID related several times during the week. So thank you very much for giving us a chance to come to you early this week. And actually, in many ways, we've got what we believe is very good news and encouraging outlooks for the state related to controlling and managing in a pandemic. As always, we talk about the New Mexicans that we've lost, and that's always very painful to highlight that directly, but we do want to know that this is still, even though we've got good news to share today, a deadly virus that will live among us, which will require our attention and vigilance, regardless of that outlook and the tools, strategies that we have available to us. So with that, everyone, let's go to the first slide. Okay, so we wanted to start with, actually, I'm going to have to, let me do this, everyone. Thank you. We're all working on technology. So typically what you're accustomed to is for me to start with the number of case counts and the hospitalizations, and unfortunately the number of New Mexicans that we've lost. We are certainly going to talk about that, but we wanted to start on a different note and really show that given the work, the public health practices, the strategies for safely, engaging in work and school and grocery store shopping, et cetera, childcare activities, going to get our necessary medical appointments, all of that if we do that effectively, then in fact, New Mexico can move from red, where we were basically all counties were red, that we move into a yellow and then green phase. And of course, what that means is every time we get closer or get to green, it means that more things are open. It means that we can take a little more risk because we've lowered that positivity rate. And what does that mean? It means that the virus is less prevalent, which means it's not spreading in the way that it was, which means we have sort of managed control. It also means that we're doing a good job with vaccines. It's both. So I really want to point this out, that we went from a red state to now a multicolored state with many more opportunities and opening up a little more risk to the state while still being very COVID safe. So now we have 15 counties that are the yellow. I'm just going to read them because this is great news. Bernalillo, Cibola, Colfax, Curry, Doña Ana, Grant, Guadalupe, Los Alamos, Mora, Quay, Sandoval, San Miguel, Santa Fe, Taos, and Valencia counties. A nice cross-section, frankly, of the state, with so much going on in the center region of the state. We're feeling very positive about the outlooks for neighboring counties. They're close. Also want to highlight that 4 counties are at the green level: Union, Harding, Sierra, and Catron counties. And now holding that and making sure that the counties, again, that they're bordering get green is what we want to see occur, and we're feeling really good. I want to note that 29 counties, and for folks maybe not from New Mexico visiting, watching this, we have 33 counties. So the vast majority rate now have positivity rates below 10. This is a considerable factor in showing that the state is steadily, and continuously moving in the right direction. I'm very excited about our progress. You should be too. This is an all-together New Mexico effort. It says that we are getting closer and closer and closer to returning to a more normal environment pre-pandemic. So congratulations to these counties, congratulations to the state, congratulations to every single New Mexican who's been doing their part, wearing their masks, thinking about that triangle, no more than 3 trips, and really working to keep themselves and their neighbors and communities safe. Next slide. All right, I just wanted you to really see it. I said it, and we'll go to the next slide pretty quickly, but look, this is just from January 12th to February 10th. Look at the difference in movement. Now, again, this is really 2 parts. There are going to be folks who, and you'll hear from Dr. Grace and Dr. Collins, it's all vaccine. It's not all vaccine. While that plays a pivotal, critical role, and New Mexico's doing an incredible job, we also have to maintain good public health and COVID safe practices. So it's that combination. More businesses doing surveillance testing, more employees given the tools for COVID safety, more New Mexicans doubling and tripling down on their own COVID safe practices. All of those things with vaccine, which means we're building up immunities, mean that we're moving into a place where we are as safely as practically possible, moving into a much better environment for New Mexico. So this is incredible in just these 3 weeks. All right, 2 weeks. Next slide. I'm not going to read all of this, and I know that we all appreciate that. And the reason I have the slide up, however, is that it can be confusing what's in red, what's in yellow, what's in green. And, you know, the basic concept here is that we add more people into the environments that we're already visiting or shopping at or engaging with. But it also opens the door to additional outdoor recreational and other opportunities which support our families, and as importantly, they support our small businesses who this pandemic, not just in New Mexico, but around the globe, has just really unfairly punished small businesses with indoor clientele like restaurants. And so this is a way for us to really embrace that we can add more risk. So I'm just going to give you a couple of examples. You increase the amount of people who can be at essential retail. That's small businesses. We allow indoor dining. And in the winter months, you know, that's been a real hardship by restaurants who have figured it out. And we are really proud of them by having heated outdoor spaces, but it's not the same. And our winter months can be harsh here. And so this allows us to increase outdoor and start to go back to indoor. It means that more folks can go to their houses of worship. It means that we can double the amount of people in a mass gathering and the number of vehicles that participate in a number of those things. It also gives a little lift to our hospitality industry. This is usually posted outside many businesses. Thank you, New Mexico businesses, for doing that. You can also get it at cv.nmhealth.org, and any pandemic COVID-related information you need go no further than the Department of Health. So I hope this was helpful in giving folks a sense about how we're moving and what's now available in so many, 15 counties, half of the state now. Okay, next slide. Green level, again, you can see this is the same kind of concept, right? We go from 33 in essential retail to 50%. So we're adding more people. And the reason that we do that, right, in this incremental strategy is because more people create more opportunity for this virus to move. Still means we got to wear masks. Still means we got to have adhere strictly to COVID safe practices, but you can see that we just keep adding to the number of people who can be participating at the same time in any number of our establishments. Most important thing here is 50% indoor dining. And it's really a boost to those restaurants. They need us, but it also allows us to manage that risk as safely as possible. Why? Because we've reduced the amount of virus that's moving around. So just reducing that risk means that at the same time, we can create a little more risk because we've done such a good job, right, minimizing opportunity for the virus. If you minimize it here, if you crush it here, you can expand somewhere else. I do want to point out that closed contact recreational facilities are still closed. Movie theaters, bars. New Mexico is very close. And I want to give a shout out to the Recovery Council and the industry experts who are beginning to look at tourism months, opportunities in the spring and summer, and really thinking about ways to make sure that we are ready to engage in those activities as well, and looking for bringing even more COVID safe, I hope, practices to those environments. So I don't want folks to think that the green is where we end. The green says that we've done such a good job that we can begin to do other expansions as well. I don't have a name for it yet, but look for Green Plus coming to you soon. Okay, next slide. All right, so this is how we typically start. So today, of course, is the 10th. This is our COVID update. We have 512 new cases. We've seen a steady decline. We've gotten as low as 300. We want to keep seeing that decline. That means that we've had a total of 178,790 total cases statewide. We're at the lowest. Dr. Grace will probably do more in-depth updating. 379 COVID hospitalizations, 74 individuals on ventilators. Again, these two issues are where we really focus to make sure that we've created a safe environment. We've protected our healthcare system. We're minimizing transmission. These two areas give us unequivocal data that that's occurring. Unfortunately, we have a really high mortality number today. 31 additional deaths. We haven't seen it be that high since 29 a while back. That brings this grim total to 3,461 total deaths. Remember that unfortunately with the mortality issues, you know, we see an increase in cases or we don't see a decline in cases. A percentage of every positive case means that we've got a hospitalization. A percentage of those hospitalizations mean that individuals succumb to the virus. And unfortunately, some folks never get to the hospital. They become so ill so immediately that we lose them before they can access healthcare treatment or hospital care. And so I don't want folks to let down their guard. This is a deadly virus for far too many, with, in addition, severe long-term consequences that we're still learning about. So good news, cases are still either stabilizing or declining. Positivity rates, as important, are coming down. Hospitalization rates coming down. Number of people in critical care, ventilators coming down. And we want to keep seeing the mortality rate decline as well. Testing, an incredible 2.5 million individuals in the state tested. I'll take I know it's going to be discussed by Dr. Collins. Vault is that in-home testing. It's free to New Mexicans. I really encourage you, register, get those tests. You know, you can really help us, because if we know that we've got a positive case, we can do something about preventing an outbreak. That's the whole key, staying ahead of this virus all of the time. Please get those Vault tests, take them, mail them in. It's not a one-time, you can have them all of the time. I really want to encourage New Mexicans to do that. That's not to say we won't see you at any of our testing sites, but we can see that as the virus doesn't seem to be as critical, there are too many New Mexicans who don't think about testing as a critical role. Testing is the key to getting to green. If we know that there's low penetration of virus in that community, you're in the green, you're in the yellow. So New Mexicans, get tested. Help us continue to make this progress. I don't know if I have any more slides. Do I have another slide? Yes, and basically I think it's just to make sure that I don't forget any strong messaging to summarize my update today, which is testing, which I just did, plus vaccines, plus the hard work at engaging in COVID safe practices, all the sacrifices that all of us have made, staying home, being separated, from our families so that we don't mix families, changing the way in which we celebrated and recognized holidays. All of that means that we can beat back this virus. And the only way that you do that is you got to stay the course. And I just want to point out that because it can often feel in these updates that I think not just to New Mexicans, but to every human around the globe, that this punishing pandemic, right, it's never ending. And as we know, this virus will never disappear, but the way in which we control it, that changes. And that hard work pays off. I mean, this week we averaged 475 reported cases each day. That's a 66% decrease from just a month ago. 60% decrease. Way to go, New Mexico. And the fact that we've been so aggressive about tests, averaging about 12,000, we've got capacity to do far more than that. And while that's shows you that we're getting it done, let's just all decide as New Mexicans that we want to double that per day. The more we know about where the virus is, the better we can do. But we thank you for participating, and I thank our departments for so aggressively getting out there. I want to highlight more good news. Look, New Mexico ranks 3rd nationally for testing per capita. And actually, we have had the 15th lowest test positivity rate among the US states. Now remember, why is that so incredible? Because we have less, right, of these public healthcare resources, of healthcare professionals for any number of unfair reasons, a lot of them actually tied to old Medicare law. But being a rural frontier state, it should be much harder. And if they used those tests to say, all right, these states with those issues get ranked in their own group, New Mexico would be by far in the #1 position. We are doing incredible work together. And this is how I know that that light I said that was tiny, but I could see it. I now feel like it's a big headlamp, and I am racing with you towards it. We are doing really well. We can keep making these improvements. If you want to get our weekly epidemiology, right, that's our population health information about how we're doing in New Mexico dealing with COVID, you can go to cvnmhealth.org. And the last message again is that the state and the feds and any number of decision makers, policy makers, experts, researchers, scientists, healthcare providers, we can do a ton. But without everyday New Mexicans, we cannot do the work that protects us all adequately and saves lives. Only New Mexicans can do that, and we're doing it. I know that it's been a long, tough, uphill road, but New Mexicans, we're resilient and we're strong. Frankly, we're amazing and we're getting it done. And today is a day to really feel good about the collective efforts of the state and to be confident that these collective efforts will win the day tomorrow and the next day and the next day. All right, I do believe now, Nora, this is my last slide, correct? And if I don't see another slide, I am correct. Oh, it's not. I apologize to everyone. I get to brag about vaccinations. We're also #3 in vaccinations. Now, this is incredible, again, for the same reasons that testing is incredible. We have less of the human capital available to do this kind of work. I will tell you that the federal government has been reviewing our database, the way in which we get folks registered, how we're managing appointments as part of a national model here. And again, I am very proud of this. The #3 in the US is the first shot. We're number 6 in getting the second dose of the vaccine. We're number 4 in the states for the percent of vaccines used. I will tell you there's some awkward issues that are being addressed by the federal government that are holdover issues in the way in which CDC was gathering data, how they were accounting for the first dose versus the second dose. But no matter that confusion, New Mexico, again, is leading in the country. Let me just repeat that. New Mexico, again, in COVID, is leading in the country. And to every vaccinator out there, we owe you such a great debt of gratitude for the incredible work that you're doing. And again, what does it all mean? It just means that we're creating immunity against the virus because we're efficiently using vaccine. And I know many of you are still incredibly frustrated waiting for a vaccine. You registered immediately. You got contacted by any of our partners like Aging, because not everybody has the ability to get online to access a database and get registered. We don't have the tools or the expertise or the internet. Some of us can't drive to an appointment. So we have all of those systems that are robustly ramping up so that we can do that, including doing specialized clinics within our population distribution, right? 75 and older, 16 to 74 with serious underlying conditions. We're showing that you can efficiently get this vaccine out. For those of you who have so patiently been waiting, New Mexico just needs more vaccine. We don't need another strategy to get it implemented. We don't, and we're happy. The feds have certainly said to us, the Biden administration, that they are going to give us more mobile clinics. So this means vaccines come to your door, particularly for vulnerable populations who cannot leave their homes. We're coming to you, and that is really helpful. But the most important thing, and I want to point out that the federal government has been increasing the amount of vaccines available to us every week and giving us real predictability in sort of a 3-week review. But New Mexico could do 50,000 shots in arms a day. We are really well equipped. Shout out to our healthcare network and all of our partners. We just need more vaccine. The second we get more vaccine in the state, I guarantee we're going to continue to lead the country, get shots into arms, and really put ourselves in the best possible position to not only protect ourselves from COVID, but to allow ourselves those day-to-day activities that bring risk, but also bring us back to a more normal set of work, life, and efforts in our neighborhoods and communities. So I made that point. We are, unfortunately, we need the federal government and our vaccine manufacturers to just get us more access to more vaccine. And you can count on your providers to get it done. Okay, next slide if I have one.
We do have a couple more, Governor, and Secretary Collins is going to lead us off on the next few slides.
Okay, then I'm done. All right. Thank you, Nora.
Thank you, Governor. And I just want to add that currently we've received more than 394,000 doses, and shots in arms has been more than 365,000. So we're distributing about 93% of the vaccines that we've received, and on average about 9,000 shots per day. Fortunately, as the governor mentioned, in the last 3 weeks, we've had slight increases in the amount of vaccine we've received. Last week, it was a 16% increase. This week, a 6% increase. And next week, about a 2.5% increase. And we can continue to hope for more moving forward. Currently, we're expected to receive 61,000 doses next week. And we're certainly prepared to receive more. And as the governor mentioned, distribute more. So we are really fortunate that over the last 7 days, we've vaccinated 61,173 people. And if you think about the number of cases we've recorded, 3,325. So we're 18 times more likely to vaccinate than to have a new case, which is awesome. 73% of New Mexicans who've registered in 1A have been scheduled for their vaccine. And so we've been very fortunate with our distribution. Next slide, please. I want to remind everyone of who's eligible. Currently, we are vaccinating persons who are in phase 1A, which let me remind you, hospital personnel, residents and staff of long-term care facilities, medical first responders. And once we get through these folks, as well as persons who are 75 or older, or 16 or older with at least one chronic condition, we will then move to frontline workers who are unable to work remotely. And I do want to remind everyone that to go to the site and register if you've not for your vaccine, vaccinenm.org. It only takes a few minutes, and it'll ensure that you'll be notified the moment you're eligible for a shot in your area. And we've been fortunate that more than 600,000 New Mexicans have already registered. Next slide, please. And so again, please visit the website. And I do want to remind you that it's important to continue with the COVID safe practices, wearing a mask, washing your hands, avoiding groups, and limiting unnecessary travel. So thank you, and I'm going to hand it over now to Dr. Scrace.
Thank you very much, Secretary Collins and Governor. It's always more fun to do these press conferences when the news is good, and it continues to be good. And so thanks to everyone in New Mexico for their hard work, and thanks to everybody working on this vaccine effort. We truly are leading the country, and the progress has been amazing. I wanted to alert people again, and I'll keep talking about this week after week, that there is treatment for COVID-19, and there's treatment that if you are over 12, have symptoms, and have a condition that puts you at higher risk for COVID. And you can find that on this website here that we've set up on the DOH. You are eligible for treatment that will reduce your chance of ending up in the hospital by 75%. There are lots of frequently asked questions on here. You can educate yourself. This scrolls down 2 or 3 screens. I won't do it today. And this presentation will be available, and you can click on the link here. Also, this map, you enter your zip code, and it will show you a map of infusion centers near you who can provide the treatment. And when you find out about your positive test, you'll get these links, but you'll also can talk to your primary care physician about a referral to get you into the system to get treatment. The sooner you get treatment after the positive test, if you meet these criteria, the better. It used to take an hour to infuse this. Last night, the CDC came out, or FDA, I'm sorry, and said we could do it in 16 to 20 minutes. So it will take a lot less time. There are 3 options, a new one announced last night. It's not important that you know how to pronounce the names of the antibody treatment, because nobody can really do that. And I've spent months on bamlanivimab, but there are others that I can't pronounce. But these are available, and we're talking to providers in the state, practitioners, physicians, nurse practitioners, physicians assistants, educating them on this as well. So please, if you test positive, consider treatment and consider it early on. Next slide, please. I did want to just update folks on the transmission of new variants in the United States. I think we've heard about new COVID variants from London, from South Africa, and from Brazil. We're monitoring these very closely, and we're monitoring our own test results to look for activity. In our state, we've had a couple cases of B117, which is the London virus. And the reason we're concerned about this is it seems in other countries, it's spreading a little bit more rapidly than what we know of the viruses and the many. We've had dozens of varieties of the virus in our state as well, but this one seems to spread based on very early data more quickly. There is early data about a variety of these variants that show some might not be as, some might be resistant to some of the treatments we have for coronavirus, and even one of them that could potentially be resistant to the vaccine that we're all getting. And so we are in a bit of a race to get everyone vaccinated and to get as many people immune to the basic version of coronavirus. At the modeling team this week, there was a caution expressed about us being in a vulnerable period. Well, as people are getting vaccinated and these new variants may be spreading in the country. We're a little more vulnerable. And so just encouraging everybody, if you do get both vaccines, stay at home. Don't take any chances for another 3 weeks. Even if you're in a yellow county and want to go out to dinner, there is a vulnerable period here, and we'd like everyone to be careful as we go along. Next slide, please. These are our case curves. You can see we're doing great. We're on a really sharp downslope, and if you look at that 459 cases by date of specimen collection over 6 days, and we have a lag in 7 days, we have a lag in year 2, but cases continue to go down. You have to go all the way back to early October to find a time when we had these few cases. So this is very encouraging. And of course, everybody's very happy. The top line is the whole state. The bottom 5 lines are our various regions of the state. All of them have downward trends. And just to make that point that Secretary Collins just made, and we said last week as well, we're vaccinating 18 to 20 times as many people a day as we have new cases. Obviously, a formula for success. Next slide, please, Alex. This is my favorite slide. I'm going to take a minute. I asked Los Alamos National Lab to simplify it for all of you, and they got it to the level that I can understand it. And now I want to hopefully have you all understand it. There are 2 lines here. The first line, the red line, is the cases we would have seen in New Mexico and are projected to see over the next month. And so we're right a little bit more than halfway between the January and March tick marks. The black line is what we actually are seeing and what we are projecting for cases because of or based on the fact that we're vaccinating. And this week, we're able to say that 16% of the decrease we've seen in cases, 16%, we've seen a 16% decrease in cases as the result of the vaccine alone. Note that those lines get further and further apart, which means as time goes on and we vaccinate more people, the vaccination itself has more and more and more effect. And when we get out, I don't have that graph today, but when we get out to June, there's a very, very wide difference between those 2 graphs. So this is really solid evidence, 2.5 weeks in a row now that the vaccine is working, and we're beginning to see an effect that's showing up here in our state, something that I'm particularly excited about. Next slide, please. There are 3 curves here, and I apologize for the small print. Our case count I just showed you with the blue line is that green graph on top. But you can see just below that, hospitalizations finally dropping off significantly, and deaths on average dropping off, although today was a difficult day for us. We are seeing those 3 trends. They kind of, first cases go down, 2 weeks later, hospitalizations start to go down. 2 weeks later, we see a decline in deaths. And so all of those are now happening, which is encouraging. Next slide, please. Just our gating criteria, which are becoming relevant to all of us. Again, we've had this slide which had really no meaning as to what we could start doing for a couple months, but you can see everything is green. The only 2 things we're watching are the case count. We want to get down to 168 cases today, per day, and hospitalizations. Hospitals still full, but seriously experiencing relief. It's a tremendous relief for our healthcare workers who haven't taken a vacation in 11 months. Some are taking time off. Albuquerque hospitals, and particularly ICU, still at above their normal capacity, but much, much, much better than it's been. And so very positive here. Next slide is a little bit more information on the test positivity rates. On the right, you can see the map that the governor showed earlier with all the new yellow counties and 4 green counties. On the right, you can see the total number of cases in the past 2 weeks. And so again, sort of a darker tint in the upper left, northwest part of the state, the lower right, the southeast part of the state. Dark red in Bernalillo and Doñana, just because they have a lot more people there. But the case activity does correspond directly with what we're seeing in our red, yellow, and green mapping. Next slide, please. This is just our case counts and the numbers we came up with to rank people red, yellow, and green. There are some close calls. There are always going to be people, 0.01% above the line or below the line or really close. And we have a line, so we can make the difference. And again, just a reminder that this red, yellow, green is our attempt to most accurately measure the activity of the coronavirus in each county in the state using case counts and test positivity rates. And so we believe that this is our best way of taking our pulse in each county and seeing where we're at. But I think the main message for me is every single county is making progress, we're getting better, and we can move forward. Next slide, please. This is just a reminder of the formula. I get calls about this and people have a lot of questions, but the test positivity rate, which is of most interest to all of us these days, is the number of unduplicated positive tests, which is the same as the number of cases divided by unduplicated positive and negative tests. And because everyone's looking at it more closely these past couple of weeks for obvious reasons, just a reminder that in the positives and negatives, we don't count inmates in federal and state prisons, although we do count the staff. Inmates can't go out and be in the community, staff do. And so that's how we do that. We once a person is positive, then we don't count tests going forward. Came up in the summer about duplicate positive tests. We don't count duplicate positives or subsequent negative tests. And then lastly, for the red, yellow, green, we're very strict about keeping the data that we're getting to be relevant to that 2-week period, nothing much older, so we can get the most accurate look. So again, happy to answer questions to anybody interested either here or offline. But again, hats off to DOH. There's an enormous amount of data that has to be processed to come up with this every 2 weeks, and appreciate the accuracy and attention that they pay to this. I think I have one more slide. Alex, yep. And so for those of you who've been watching regularly, you know that my slide always says nothing about the virus has changed. And so something actually about the virus has changed. These new variants create a new risk. We're watching it very closely. We'll keep you very informed. We're worried that they may spread more rapidly, and literature is coming out every day to give us new information. Cases are coming down nicely. We're still above where we want to be. Just again, that reminder to get tested. And especially if you have symptoms or have been exposed to someone who's positive or think you have had a higher risk exposure, please get tested. Or if you're just concerned and have a reason, sometimes we all know before that we're coming down with something, before we have obvious symptoms, have a high, what we call in medicine, have a high index of suspicion and get tested. And so the same old of staying at home, washing hands, wear those face coverings, maintain social distancing, and just to repeat one last time, be particularly careful in the month after receiving your vaccine. From a community health point of view, it's a time we have to be extra cautious. And with that, Governor, I'd like to turn it back to you.
Thank you, Dr. Scrace. Thank you, Dr. Collins. I appreciate so much your incredible work. And I also want to highlight, and of course, this is what professionals do. If you dedicate your career in the way in which these incredible professionals have, you have these emergencies, they become 24-hour, 7-day-a-week jobs. We often tease that every day is Blur's day because we can't differentiate one day from the next. In fact, we had a reopening recovery council modeling a discussion, debate, application, decision-making on Sunday. And that's what New Mexicans should expect from us, that we take these jobs seriously, and we'll do whatever it takes to keep New Mexico safe and moving in the right direction. But I also want to personally add my gratitude, not just to New Mexicans who are doing what they need to do, and it's hard, but for the incredible professionals in the private and public sector. who are going above and beyond in this global emergency, once in 100-year pandemic, making a difference for every resident in the state of New Mexico and their families. So that's a great place for me to end. Congratulations, New Mexico. Again, we want this to be balanced. It is really good news. It says that the strategies we're putting in place are working. It's not an invitation to stop any of those strategies. So just a reminder that we need you. Frankly, I need New Mexicans more than ever now. This is when our fatigue could get the better of us. Don't let it. Keep hanging in there, get those vaccines. We'll keep advocating for more. We're ready. You wear your mask. Be clear that, read the CDC guidance, get online at the Department of Health, make sure you're wearing the right kind of mask, try to limit where you're going. Certainly try very hard, keep your vigilance about mixing families and large gatherings. This is how we continue to make progress and do what we can do. While the virus will always be here, we can nearly eliminate its ability to spread. Now think about that. And there have countries who have done that. Virus exists, it's out there, but they have completely destroyed its ability to spread. We can do that too. And in fact, we've shown that our dedication can really restrict that transmission, and we're saving lives when we do that. So without any further ado, thank you everyone. All together, New Mexico. Nora, we are ready for questions.
Thank you, Governor. I will remind our media friends who are on with us to raise your hand in Zoom if you have a question, and to please be conscious of the number of folks we have on here who all want to ask questions. And with that, I will start with Matt Grubbs from New Mexico PBS. Matt, if you want to go ahead and unmute, you can go right ahead.
Okay, do you have me?
Yes, go right ahead.
Great,
And
thank you. That's right. She says hi, adopt a pit bull.
I'm all about it.
Excellent. Hey, a former colleague of yours, Governor, Tim Manning, is the COVID-19 supply coordinator for the Biden administration. I'm wondering if you've had any contact with him, and if you've been able to leverage that relationship. And also for the rest of you, when every county gets to green, or when most of them get to green, we're effectively at what I understand is medium. What happens then in terms of how you handle our risk? Thanks.
So Matt, you know me too well. Look, I'm going to leverage every relationship, every human who can help us do the best possible job to benefit New Mexico and protect New Mexicans. And so Tim has been in touch. And I actually, I'm a bit embarrassed by this. I actually can't recall if on one of our emergency management, FEMA, vaccine distribution, federal supply chain support, I think Tim was actually on one of those calls, but I can't remember. But he is directly engaged. And he knows that we expect an awful lot of him, because he knows the kind of logistical challenges that a state like New Mexico can have. And I expect him to reiterate that we want and need the kind of support that we've already identified, like mobile clinics. I've also asked the federal government in partnership with the Navajo Nation to invest in more laboratories so that we can stand them up on the Navajo Nation or expand them. That means that you're doing genomic rate testing for these variants and really staying ahead, if you will, of the COVID curve in some of our hardest hit areas or regions of the state. So yes, I expect him to do all of the above. And I alluded to it a little. You know, we wanted folks to really get a sense that we can get red to green. That means expanding our risk. And then when we do that, we all know that that has a benefit to both the economy, workers, income, and economic security, and small businesses that have just been pummeled by this virus. And we want to do all of that, but it isn't where you end. It was the best way to describe a goal so that we know we can manage risk, and we're showing that. I don't know what to call it yet, but I alluded to this sort of green plus environment. Here's what I would like to see the state be ready to do. And we're already talking about it so that Lionel's looking at it and I'm using data and science to get there. So green plus. That means that in person, arguably, you'd be ready to go in that fall semester, no hybrid, right? Kids are just back in school. It means that bars, nightclubs, and high risk indoor activities, particularly where you're getting a snack or a beverage, high risk, because you have to take the mask off. The number of people in any environment creates risk. But if we crush the virus so that it's not really able to move around, we know that with the variants, that the current vaccine strategies having the impact we desire. So we're getting more and more data about that. And more New Mexicans are vaccinated. We should be looking forward to a full season of tourism, right? Getting everyone back to school and having a few limitations on those activities. That's the goal. That's the desire. That's the construct of what we're thinking about in Green Plus. And it just, again, it depends on the data. It depends on how much vaccine we get. It depends on how well we do these public health practices. But I just want to point this out. For the folks who rightly so, challenge and give us good constructive criticism and feedback. Well, without vaccines and without all these other things, you could never get there. You can get there. Australia got there without vaccines. New Zealand got there without vaccines. Vaccines are an incredible tool. And I'm thrilled that so many New Mexicans in many categories above the national averages, right, want that vaccine. That's terrific. Vaccine confidence in New Mexico should be and appears to be really high. All great. But these public health measures nearly in and of themselves can eradicate the ease at which this virus can spread. So I'm very confident that between the vaccines and strong COVID safe practices, that we're going to see a summer that looks an awful lot like in spring, the New Mexico that we're used to. But as we do that work, Matt, it's too early to tell you. Let's get all these counties in green and keep moving in that direction. Let's get more vaccine into the state. Let's remain vigilant. But I'm feeling very optimistic, and I think everyone in New Mexico should. Dr. Scrace?
Yeah, likewise, Governor. Thank you. I'm very optimistic. I do want to just remind us that the variants that we're seeing around the world could throw a wrench into the gears here. And so we're all over this. Our epidemiologists are looking at it carefully. We're reviewing all the literature, which unfortunately is just like preprints and very early data. We're doing a lot of our own genomic sequencing, but I think part of what needs to happen is us to plan for the future in a very positive way, but also remember that there's a threat out here that could be quite serious. And so I know I just threw a wet blanket on this, and I didn't mean to do that. We just have to really pay attention to what's happening with the evolution of the virus as we are being so successful in defeating the one we're dealing with now. Thank you.
I'm going to grab it right back from Dr. Scrace because I agree with him. And while I'm incredibly optimistic, the news on the horizon about, and even the CDC saying, look, the worst could be coming. What is the best line of defense? Good public health practices. And so for the counties that have struggled to put that in place as effectively as some other counties, this is the time to really lean in. Because if you don't want to see a country that ends up having to, completely constrict itself again, let's adhere to these really strong public health practices, because that's our best line of defense if we have variants that these vaccines aren't as successful at combating. So I'm still going to be optimistic that New Mexicans are going to be better than anybody else at these public health practices. But it's a good caveat. Thank you, Dr. Grace.
Thank you, Governor and Dr. Grace. Next, we will go to Chris Keller with Albuquerque Business First. Chris, go right ahead.
Thank you, Secretaries. Thank you, Governor. I guess this question is for Secretary Collins, Dr. Collins. The Department of Health, I know, today adjusted its data on the vaccine distribution website to change kind of the county level rates based upon where folks live as opposed to where they receive the vaccine. I know 26 out of the 33 counties increased its rate per 100 people of the number of doses administered. I'm wondering internally if the department learned anything from the change in data. Obviously, some of it's related to increased distribution, but some of it is probably also related to the efforts to better identify where folks are, where the folks live that are being vaccinated as opposed to where they are receiving the vaccination. Does that make sense?
Yes, thank you, Chris. So absolutely, we reviewed the data and looked more closely to determine how were we estimating what percent of a population in the county had been vaccinated. And when we realized that we were counting where the vaccine providers are located versus the residence or the address of the person being vaccinated, we adjusted to make sure we had the best data possible to share with the community.
Thank you, Dr. Collins. Next, we'll go to Tommy Lopez with KOB.
Thank you guys again for giving us this opportunity. And if we could, I'd love for you guys to come back to me at the end too for another question, but I'll keep it to these for now. Can you guys comment on any worries you had specifically with Super Bowl gatherings in terms of reopening and with those variants in terms of the travel quarantine changes? And then what do you have to say to businesses who are worried that their county, just reached a new level of reopening, but they're worried about reverting back to the previous level, going back into the red, for instance? And then thirdly, if you don't mind, we're seeing that there are concerts scheduled at Isleta Amphitheater starting June 12. I wonder, Governor Lujan Grisham, if you have any comment on that being scheduled to take place in the future. Thank you, guys.
Thank you. Tommy, I really appreciate those questions. I'm going to do the Sandia question first. I mean, businesses have to start thinking about planning to compete for, that entertainment and booking those venues. I want to give many businesses and communities and many of our sovereign nation business partners real credit. Sandia identified as an example any number of gaming openings and casino openings and then shifted and didn't do that because the cases both at Sandia Pueblo and in Bernalillo County were too high. And as you know, but maybe some New Mexicans don't know, that because it's a government unto itself, the public health orders don't apply. And so they are free actually to open, but they have been incredible partners, closing, really working hard at making sure that they protect their community using good public health data, and they have a responsibility to protect the community at large in the state. So I get it, and it's why we were meeting on Sunday, because the week before, businesses are rightfully so saying, look, as we've all worked together, and there's been a lot of shared sacrifice, and this has been shared widely. New Mexico seems to be the most restrictive. Depends on really if you look deeper into that data about how they identify what's open and what's not open. That's one. But we are a pretty narrowly focused at controlling the virus state because we're sicker than other populations. We have extreme and higher poverty than other states' populations. We have less healthcare resources. This is a different set of circumstances that require us to actually work harder than some of our neighbors. And as a result, we've not lost as many folks per capita, and we're getting the right positive attention, and we should, for equitably distributing vaccine, making sure that minority populations are part of that effort, doing everything we can for high risk populations that have a higher mortality rate, like far too many of our Native American friends and neighbors living in New Mexico. And so these worries are real, but also figuring it out in the future is real. So yes, removing the 14-day quarantine, expanding, getting to yellow. When we introduce risk, I always do this, and so does Dr. Grace, and Dr. Collins nods her head, and I appreciate all of that. When you introduce risk, it's risk. If you don't also double down on your mask wearing and your social distancing and your hand washing, and if you don't have a Super Bowl neighborhood party, all of this creates a problem. We'll have to see. Did New Mexicans get together? We'll see it in a couple weeks. That's exactly how it works. And if that occurred, that could throw a county right back in from green to yellow, yellow to red. And it's part of why we tried to create, these guardrails, because they're controllable by the general public. And if they just stay the course, even though it's hard, no one said it was easy. It's hard. But if we do that, then we can manage the increased risk by travelers. We can manage increased risk by going yellow and green. And hopefully we got the message out about these family gatherings. So I gotta believe that New Mexicans are doing better and better. And also vaccines really are a game changer, because they create that immunity that we really need, so that as you introduce risk. So the timing is good. And when we did red to green, we didn't include vaccine data. That is an issue I've asked the modeling team to start thinking about. As we get information, as we have opportunity, we should apply it. And we're working through that as quickly as we can so that it's credible. But I'm feeling confident, and we wouldn't have created the system and made these decisions earlier in the week if we didn't think we could manage them. But, and I know that you've got other questions and so do other reporters, but it's really important. New Mexico. I know that we've got essential business travel. I know that we've got opportunities, and you need to take them because they support the local economy, or you being asked to come back to work, all of those things. We want our kids back in school. Just double down on your efforts and you'll increase opportunity. You won't go in the opposite direction. And that's really the message here. Thank you for giving me a chance to lean in again. We have the power to control the virus. We just have to stay vigilant. Dr. Grace?
Yeah, I just wanted to add a couple of things, Governor. I agree with everything you said. We built the red group, which is mostly true, right? Most of the time. Anyway, the governor and I enjoy engaging in spirited, deep discussions of issues. We'll leave it at that. But when we were wrestling, not just the governor and I, but the whole team in the summer about setting up the red, yellow, green, our biggest concern at that time was creating a system that really didn't let people bounce back and forth all the time, because that's more difficult for businesses than, just staying closed another 2 weeks or 4 weeks. And so I think that 2-week period helps us smooth out the data so blips don't affect it. I think the incredibly rigorous attention the folks in epidemiology are paying to what goes in that 2-week period's worth of data, and it's only that 2 weeks worth of information is important. And I think, as the governor pointed out, there are things communities can do to retain and hold those gains. If you let up and just have one giant county celebration, that won't allow you to sustain. But testing, continuing testing, people staying home when they're sick, even a little bit sick, and not going out or going to work. And then lastly, on the question of vaccine, the more people that get vaccinated, that will directly show up, as I showed you earlier, in our test positivity rates and our case counts, because the more people that are vaccinated and immune to coronavirus, the less people there are to get the disease. So every vaccine that's given, although it'll be hard to see on an individual basis, but all those vaccines that we're giving will show up in this red, yellow, green system data. and also help and accelerate people who still need to come down further, and help those who have gone to yellow or green retain those gains.
Thank you, Governor and Secretary. Next, I'll go to Ryan Botel with the Albuquerque Journal. Ryan, if you want to go ahead and let me unmute you. There you go. Go right ahead.
Hi, Governor and Secretaries. Thanks for taking my questions. I was wondering, it seems like the number of cases have declined to just, a fraction of what they were at the peak, but deaths haven't declined as much. I was just wondering if you could explain, especially if we're getting better at treating COVID and vaccinating the most vulnerable people, why haven't the number of deaths dropped as quickly as cases?
Ryan, it's a really good question, and Dr. Grace and I talk about this all the time. Remember that the mortality issues in particular relate to cases that were and increases from earlier, right? It's like a 2-week delay between all of it. But I also want to say that in New Mexico, it also highlights that we still have far too many New Mexicans whose underlying conditions, although we have lost some New Mexicans with no underlying conditions, and some young New Mexicans who were certainly not identified in the high-risk group through CDC's. So it's again, CDC's data and advice. It's take this virus seriously, because you just don't know what it'll do to you. But that's the basic answer, and the treatments really are effective. I'm disappointed in the country's ability, and even in New Mexico's ability, to get these therapeutics into the veins of the people who need them. Part of it is it requires, right, an infusion and practitioners. And remember, we've got practitioners in hospitals and ICUs giving vaccines. They're engaged in all of it. And I think New Mexico is actually the only state in the country that's created a self-referral process to get these treatments. We got that done as cases were declining. So we're ready, God forbid, that we see an uptick somewhere where we need to do something differently. But I'm gonna have Dr. Grace go through the science about why you have these 2-week delays, and you can see deaths continue to either be too high or even rise a bit as we are seeing other pandemic indicators be much better.
Yeah, thanks, Governor. And we do talk about this a lot, and this is the thing that was keeping me up most at night 2 weeks ago, a little bit last week. But Ryan, I believe actually there is a downward trend in deaths. And I think we are now finally seeing that if you get sick with COVID, most people get better, but 6 to 8% of them end up in the hospital. You end up in the hospital, most people get better. 80% of people survive that hospitalization, go home. 20% do not, unfortunately. And typically doctors, nurses, everybody who works in a hospital do everything they possibly can to help that person survive. And so some of these hospitalizations are 4, 6, 8 weeks, which creates some of the delay. And then finally, reporting. Reporting of a death is much more complicated than reporting a test result or a negative test result or a case. So there's a delay there. If you go to the DOH website and click on scientific reports, I believe at the top, and then you scroll down a little bit, there's a mortality update that comes out every week. And take a look at that and see if you agree with me that there is this downward trend that seems pretty real. And I'm happy to answer additional questions offline if you like. Thank you.
Thank you, Governor and Secretaries. Next, I'll go to Julia Goldberg with the Santa Fe Reporter. And Julia, go right ahead.
Thank you, Nora. Thank you, Governor. Thank you, doctors, for the chance to ask 2 questions. My first question related to Dr. Grace, you're talking about the kind of impact of vaccines that was shown in this week's modeling report. The modeling report also this week and last notes that targeting vaccine to high mortality areas and populations will have the largest immediate effect on this model. I'm not clear. I'm clear that the phases are directed towards the most at-risk populations, high mortality populations, but I'm still not clear geographically whether or not the vaccination efforts are kind of targeting in that way. Like particularly, we know sort of some of the top zip codes that the state has been tracking. And my second question, I just wondered if somebody could clarify for me. I've spoken with several doctors and other medical people who say they're encouraging folks, whether they register or not on the site, to try to go straight through their own doctors or medical practices, because so many of the big healthcare providers are they're aligning with the state's phases, but they're also working through their own patient lists first, rather than kind of the random selection of the state's vaccination site. And I was wondering if you could sort of clarify if that is also your understanding of what is happening, that right now a fair number of the vaccines are not people being called randomly, but are in fact hospitals are going through their own patients. That's what they have said, at any rate, the last few weeks. Thanks so much. Hope that was slightly clear.
Always clear, Julia. And I'm going to go to your first question to Dr. Grace, and I'm going to have both Dr. Collins and Dr. Grace talk about vaccines. And you might get sort of a slightly different approach here. Here's mine. To be fair, there's not enough vaccine. And to be fair, I need hospitals and providers, and they've been amazing at getting vaccine out. I'm sure you have seen any number of national reports, calling the chase to get vaccines in far too many states akin to the Hunger Games. And there was an article about Texas providers doing that. And certainly, in fact, the New Mexican did an article about that. Hospitals are not supposed to go through their patient list in that way. We need full partners. They need to make this randomized. And I think early on, getting the reporting right and a real panic. And I'm going to actually support now, after I said random, fair, equitable distribution. If we had all the vaccine, different situation. We want people to have ease of access, and we want them to get vaccinated. That's what we want. And hospitals were critical and still are in particularly dealing with that 1A population, right? Their own healthcare workers. And they did an amazing job. But we've been really firm about getting our arms around, you got to do this Department of Health system. And in fact, I've been, I hope, constructively critical to the new federal administration that getting vaccine out to all these different providers who don't report, who have their own patient lists, who have their own systems, is not fair to the number of people who are waiting or who can't drive across the border or drive to a different community because someone's got vaccine. And the issue that I was referring to earlier is that you take them out of cold storage for your appointments, and then you have 2 or 3 left over. And initially it was more than that. I think providers got a little panicked. We don't want to waste vaccine. I mean, the general rule here is we will not waste vaccine. We will prudently make sure we're getting vaccines into arms. That created some of this. And if hospitals are still reporting that to you, it shows you that we've got a credible, transparent system where we're all telling the truth. And it's an area that Dr. Collins is continuing to work to tighten up, and she will continue to do that. Because if I was a recent patient and I've got a health record at a hospital, I'm more likely to get a vaccine than if I haven't been in several years. And that's not a fair way to distribute limited vaccine. It is not. And so without picking on providers, this is a place to be very clear. The system we have created was intended to provide equity, fairness, and a responsible effort. And when providers don't work with us exactly in that way, they actually prejudice other New Mexicans, and it's wrong. So we need them to help us get it right. And I appreciate that. So that's my 2 cents, and I'll give it to the medical experts on both.
Yes, thank you, Governor. And thank you, Julia, for the question. We are definitely in the stages of making sure that our allocation plan addresses vaccine equity. And we're looking at social vulnerability index, to your point about zip codes. The social vulnerability index, as you probably know, is a measure of a community's ability to survive a natural disaster or pandemic. And what you can do is you basically look at the factors like housing, poverty, access to transportation, and you give them a ranking. And it's from 0 to 1. And a 1 means that you have a really low social vulnerability index. And so you really are at risk for having bad outcomes. We're using that information in New Mexico to target how we distribute vaccines throughout the state so that we account for that. So it goes against this hospitals looking at their patient population. What we want to do is guide them to really target the most vulnerable, those most at risk for bad outcomes. And that's what we're working on currently. And part of that strategy, we have a team looking at equitable assignment by vaccine appointment, community engagement, community plans, working with health councils. So I have a large team that's working on vaccine equity to address the question that you raised.
Thank you, Governor and Dr. Collins. Next, I'll go to Chris McKee with KRQE. Chris, go right ahead.
All right, thank you very much. I had a couple questions related to sports first. We continue to hear from parents concerned about youth sports. There is the tie between schools going back for hybrid learning and allowing for team sports. Are you considering revising this at all? Essentially, as I understand it right now, if a school is not in hybrid, they cannot resume their sporting sort of competitions. So I know Albuquerque Public Schools has gone on the record saying that they don't feel this is fair. They would like to get their teams restarting even if all their schools aren't in hybrid yet. A second question about sports. I know we're in yellow for Bernalillo County now. It isn't explicitly outlined in the plan, but will this allow, this yellow status, allow for something like the University of New Mexico to host a basketball game, the few that they have left on this season? Or is that still kind of off limits? Thanks.
So let's do the university basketball. What's tough about that, of course, is, and they're doing productive work, right? So even in the football effort, although lots of debate about being in Las Vegas, it's both making sure that you don't have in-person spectators and limiting that, but it's also making sure that you've got a testing and so a surveillance and that you've got a social contract with those players so that everyone is protected. We continue to work with the universities on that. I've got confidence that they are doing better and better. And while yellow, you're right, doesn't explicitly say that, we've been working sort of as a parallel to the universities about how to do that under the confines of the current public health orders about how to do that. So I don't have an answer about whether they'll be able to resume basketball. I would like them to be in a position in yellow and with the current public health orders to do the work that would allow them safely to engage in some competitions. Again, now that we are changing the quarantine order and some other things, those opportunities can be reflected so that those opportunities exist, as you can see, not tied to yellow per se, but in other public health orders. I worry that the school messaging around the country, and certainly here in New Mexico, got disconnected. It's not that we were holding school athletics hostage and, if you will, coupled them with, if you open here successfully for 2 weeks, then you can do sports. And some folks who, in my opinion, have erroneously identified that as, kind of a lobbying effort. Absolutely not. Here's the issue. With schools back to school in a hybrid, we are doing the kind of surveillance and monitoring, right? So it's testing and it's all the right protocols that lend themselves to doing that also with sports, so that we're doing it for the entire group and we've got the data for all of it, which we believe if we do that under the COVID safe practices we've identified, will work. And if you're at school and those kids, and they're safe, and we believe they will be, to deny them for a long period of time the ability to safely return to some of those sports activities also doesn't make sense. The problem now is we've got folks who are, and I've made this point, that also getting it all together in the schools safely in the right time frame Unfortunately, we've got kiddos and parents, and I understand the emotional and the physical activity components where it just felt like you had to travel. They're traveling. They aren't getting tested. There's not a surveillance protocol. There isn't data about that. They're going around the country. They're not quarantining. This puts us in the safest environment and providing the most opportunity to kiddos. I don't know how somehow that got communicated that, one was tied to the other in a way that was to force folks to come back. They're connected in that same 2 week of data, and they're connected in a COVID safe practice environment that makes sure that coaches and educators and their kiddos are safe and their families. And so I am hopeful. We got 50% of the districts going back to hybrid learning. We're seeing, as you saw, incredible work in the green, yellow, red effort. And we want our families to have access in a safe way to the kinds of things that really make a difference. And we know that sports, in terms of your acuity issues in learning, are productive. And we want kids to have physical fitness, which is why we've been allowing the conditioning and that kind of work, because we could do that safely, and we really wanted that. So I disagree with sort of how that got communicated out there. That's not intended to say you did that, but just people talking about what this could look like, and certainly watching some of these school board meetings. I don't quite understand how they came to those conclusions. And we do the data in these sort of 2 weeks. That's how we know that we're moving safely in the right direction. And again, I've reiterated this several times. It's creating an ecosystem of surveillance, COVID safe practices, and keeping kids in those pods. That's what really makes the difference here. And if you're doing sports unequivocally by yourself and there's no surveillance and that pod work, we don't have the same safe environments protecting our educators and our kids. And that's what we are aiming for.
Thank you, Governor. Next, we'll go to Matt Reichbach. Matt?
Hi, thanks.
Go right ahead.
Thanks for doing this. I just had a couple questions about vaccines. One is at the vaccine dashboard. Now it has a little area where it mentions the federal things from the VA, the IHS, and the Bureau of Prisons. Are those doses administered by the federal agencies included in New Mexico's total numbers? And also, you mentioned earlier about the possibility of mobile vaccination clinics. How would those work, and when would these be expected to start?
I'm going to certainly defer to the expert, which is Dr. Collins, but two things. The federal government really does want to help, and they are, and they did the most important thing. The Biden administration gave us access to more vaccine. So that's a huge sigh of relief for every governor, and should be for every American. They also recognize that having federal support as vaccinators can be useful. And New Mexico identified early in this conversation that, a mobile clinic, which imagine if you are at home in one of those high-risk zip codes that Dr. Collins was talking about in our vulnerability factors, and you've got a lot of hospice individuals who are getting care at home. We need to get the vaccine to them. What about remote areas where it's been really difficult, right? Both in terms of cold storage, extremely cold storage, and it's difficult to move people because they don't have the transportation access. So think about really remote areas of the state. Think about, again, sovereign nations. This is an area where we could cover an entire area in a day or 2 days by having a mobile vaccine clinic. So that's the concept. We haven't identified the where yet because we don't have the what yet. We don't know exactly when they're coming. It's imminent, and we don't know how many of these mobile units and the folks who will staff it quite yet. And Dr. Collins might have an update that I don't have from the federal government on those vaccine clinics. And part of identifying those other partners, and I want Dr. Collins to talk about that, is when we initially, and as you saw in our dashboard, the state gets per capita doses of vaccine. But the federal entities have their own vaccine. And it's basically sort of not exactly the same, but think about it per capita for sovereign nations, for the Veterans Hospital and their patients, for defense, for their prisons and detention centers outside of, their healthcare providers, their 1A. And the issue for someone in my position, governors, is I want to know what percentage of people in the state, right, working here, residing here, whether they're a federal employee or part of the Veterans Hospital or in a sovereign nation, if they're vaccinated, and they are, what does that do to the total population percentage that are getting vaccines? And that data wasn't reported to us directly or readily, and we're now asking them to do that. I will say that it's an incredible challenge for the Department of Health to get access to that, and they're doing an incredible job. But for all of our data wonks, which is we've got great media in the state of New Mexico, if you see some weird variations, we don't get it directly from the feds yet. We have to sort of chase it. My expectation is that the Biden administration will clearly give that to us. I couldn't get it for testing in the last administration, but I want all that information now. And that's why, because we have a higher penetration of individuals vaccinated when you include all those partners and all those vaccine doses that are coming. Dr. Collins, what did I miss?
You hit it just very well, Governor, but I do want to add that the federal entities are distributing their own vaccines. And for the mobile vaccinations, we're actually putting in the paperwork to get that set up. So we should have more information in the next couple of weeks. So we're very excited about that.
And I'm really mean. I want Dr. Collins to have it all done by tomorrow. I will tell you that the Biden administration is telling me they're ready. So as soon as the Department of Health does its due diligence, we will have it done. And I'm really excited about this. And I think New Mexico is likely to also lead the country in both this concept and the execution of this concept. So it's another place to be proud of the experts working on your behalf. I know I am.
Thank you, Governor and Secretary Collins. Next, we'll go to Scott Weiland with the Santa Fe New Mexican. Scott, go right ahead. Scott, you're unmuted if you want to go ahead and ask your question. Okay, Scott, I'm going to come back to you. Next, we'll go to Sean Griswold. Sean, Zoom is letting me know that I cannot unmute you because of an older version of Zoom. So if you want to message me, we can figure that out. Next, we'll go to Algernon Damaso with the Las Cruces Sun News. Algernon, go right ahead.
I am glad that my Zoom is new enough to let me participate. Thank you, Nora and Governor and Secretaries. One question about county level allocation. Another factor that is in play is just simply demand. How to what extent counties distributing more vaccine and saying, hey, we need more makes a difference in our allocations. I'm wondering how much interaction you're having with counties, who you have those interactions with, and what counties can do if they're thinking, hey, not so many of our people per 100 population are getting vaccinated. Are there ways we can speed this up so that we can host more community events and get more shots in arms? Thank you.
So I'm going to go right to Dr. Collins for that. And Algernon, I really appreciate the question. I do want to we need every partner. And vaccine demand, vaccine credibility, vaccine distribution, we do that better if we're using local bodies of government and messaging and distribution plans. I want to narrow it a bit that without a specific, say, county plan, that the Department of Health, because we're a centralized public health state, and the private partners that both have to do what we say in a public health emergency. And that's why they do it, because you want to have a cohesive, straightforward, manageable plan. Otherwise, you can't make the kinds of differences that you need, but also we don't have to boss them in that way. Our private providers and our healthcare community have all been amazing in this crisis and have all doubled down on giving us their expertise, time, and talent. We have enough right now to put lots more, 50,000 vaccines into arms without all of these unique factors in any community. I mean, we are ready. We just need more vaccine. Now that I've said that, because I hope, I don't want anyone to feel like I'm disrespecting local empowerment, expertise, support, and their ability, even in a mobile clinic, to make sure that that's reaching the individuals that it needs to reach. And frankly, it was local communities that really helped New Mexico get control better than, frankly, in my opinion, any other state over getting nursing home populations vaccinated, because the federal government just sent vaccine to private providers, didn't give them the tools or support. And guess what? Around the country, nursing home residents did not get vaccinated effectively, nor did the staff. That didn't happen here because we got a heads up by local bodies of government and policymakers who said, you need to engage directly and take control. And we did. So we need them. And I'm going to go to Dr. Collins about how she envisions how we might do more of that. But I also want folks to know, we just need more vaccine. If we can get more vaccine, it's going to get everywhere pretty readily. It really is a supply problem more than anything. Dr. Collins?
Yes, thank you, Governor. We really need vaccine providers in every county. And so we're working to identify persons who can vaccinate, not just healthcare personnel, but community members. And also, you know, we talk about getting New Mexicans to register to receive the vaccine. We also want vaccine providers to register on our app. That way we can work with them to push appointments to them, identify where there are people who are waiting for a vaccine if they have doses about to expire. So it's really about working with the counties closely on throughput. And that's certainly a part of our plan.
Thank you, Governor and Secretary Collins. Scott Weiland with the Santafe Mexican. I'm going to come back to you and try again. Scott, are you there? Scott, we're not hearing anything from you. Okay, we're gonna have to put a pin in that one. And Governor, I will turn it back to you to wrap us up.
Well, I'm going to do a terrible thing, which is, you know, it may not be fair to some other folks, but Mr. Lopez, Tommy Lopez, did you have one last question before we end? You said you wanted me to come back to you. The fact that I remembered that ought to be widely acknowledged, because that's hard.
Yes, I did. Thank you so much, Governor Lujan Grisham. This is actually for Dr. Collins. In this presentation, you guys have touched on the fact that educators and school staff are next in the vaccination phase when we can get there, and we know many teachers are already getting vaccines. Can you comment further on a specific timeline for more teachers getting to the full-on prioritized stage in vaccinations? Thank you.
Yes.
Oh, go ahead, Dr. Nope, Dr. Collins has this.
Yeah, so I appreciate that. And we're definitely looking to get more vaccines so that we can move quickly down the list. So it's a matter of the pace at which we receive the vaccine. Currently, we're looking at the 75 and older, healthcare personnel, and persons with chronic conditions. Many teachers have a chronic condition, but specific to the frontline essential workers who cannot work remotely, we're looking at a few weeks down the road, but I cannot give you an exact date until we really see the cadence of vaccine doses coming into the state.
But I want to highlight that our fair, equitable, and our ability to push vaccine means that the highest risk educators, as we announced, you can go back to school, get vaccinated in the same equitable way that we're doing everyone else. So, I mean, we really are doing, in my opinion, and I think it's not just going to be mine, because other states are now asking us, how are you doing this? With a ventilation, we addressed ventilation. We've addressed incredibly effective COVID safe practices, mask requirements, surveillance testing, which we've been doing all along, and then we're going to do more of. That this ecosystem, including having which I think will likely be a high percentage of educators vaccinated going back into the classroom, we should have, if not the safest environment for educators, and where CDC is showing, and students, that it's not high risk in the context that we thought it might be in May when we closed schools. And now we have vaccines, which is also a game changer. I really firmly believe that New Mexico is doing it exactly right. And I appreciate educators, the union, superintendents, and parents all weighing in for us to get it right. I will say I'm disappointed that we don't have more schools coming back, that there's been a lot of misinformation. We heard that misinformation, including that educators have a 30% positivity rate as an industry group. That's not true at all, anywhere. And so we're working really hard, and I feel really good about the safe practices. And I am hopeful that all of our local school districts will get their kiddos back to school, and they can count on us to keep doing our part. Effective testing and surveillance, wastewater testing, training, support, COVID safe practices, investments in ventilation, and any number of efforts, PPE, all of the above, and vaccine, so that we have the best ecosystem for educational safety in a pandemic and productive outcomes for students and their families. So I want to thank everyone.
Governor, real quick, I'm so sorry to just interrupt you. I'm going to try and go back to Sean Griswold, who I think we have back. So I'm just going to try and wrap it up with him.
That's fair.
Sean, do we have you?
Yeah, I'm here.
Perfect. Go right ahead.
Thank you so much, Governor, doctors, Nora. Appreciate you for the patience and everything. Just a couple quick questions here. The first one should be quick. Wanted to get an update as to when we can expect the race and ethnicity data to show up on the vaccine portal. And then you spoke on this a little bit earlier in terms of getting information from federal vaccination efforts. So I'm curious if Indian Health Services is sharing any data with the state that identifies zip codes or counties for people that receives vaccines from IHS. And then my last question is, how is the state encouraging New Mexican residents to register on the portal, even if they're a tribal member who normally gets healthcare through IHS? And again, thank you so much.
Welcome. I really, I get very jazzed about the interest in the vaccines, the registration, and you are right on. I've been, frankly, very public about my frustration with getting information from federal partners. And this is not a ding on IHS providers, Indian healthcare providers, and their epidemiologists are doing incredible work in the state of New Mexico, but we can't get good data. I know that we are actually calling in to our IHS local partners. They tell us in the aggregate how much vaccine is getting. They tell us about the populations that are being vaccinated. Some of the sovereign nations make very specific designations that don't have to match, frankly, the CDC, although they did healthcare workers and seniors and first responders. But it's not exactly like our distribution. I'm going to go to Dr. Collins to find out, more than us calling, what's now coming in directly from the federal government. I don't think it's enough. I certainly don't believe it's by zip code. And it is an area that I'm going to continue to push the federal government to get right. I mean, interestingly enough, they want that information from us, but aren't providing it in return. And it's been a source of pandemic effort, frustration for me at the federal government since the onset. But right now we call them and ask them to report it to us. And then I complain to the federal government about their lack of transparency and the fact that they don't make it easy for us to get our arms around the number of people who are vaccinated and what populations are vaccinated and where. Dr. Collins, did I get any of that wrong?
No, but I do want to add that IHS, the timeliness of reporting into NMSIS, our registration system is not there. It's not what it should be, and that's going to take some more effort. It does take time and resources to do that, but that's the best way to get really accurate race ethnicity data. And to your point about placing the race ethnicity on the dashboard, we will place it there when we feel like we're confident that it's accurate. We don't want to put something up and then have to take it down and explain. So we're very close to being able to report that information.
And you know what Dr. Collins was really saying is that the governor wanted it yesterday, and I have a responsibility as a expert and a doctor and a public health expert and a manager and director and a mentor and champion to make sure that it's right, and we want it right. So that was a good caveat, but we are moving quickly because it's important information, and we want to be accountable for equitable distribution that also does what we all expect it to. So I will end with this. It means that we are controlling the virus and keeping it from getting to the folks who are most likely to be really sick, hospitalized, or could lose their lives or have long-term chronic impacts. We also know that these are often multi-generational households, which means, the spreadability issues are complex. This is how we get at it in the most effective way. And again, the benefit to all of that, we're focused on saving lives, focused on keeping people out of the hospital, we're focused on making sure we don't create new chronic conditions. The other benefit of that is we get to reinvest in our economic successes and economic security because more things can be open and we can go back to some of that risk. So I appreciate Dr. Collins very much. And I have no doubt my money's on our Department of Health to get it done quickly, efficiently, and accurately. And New Mexico, congratulations. Keep up the hard work. We are getting to the other side of this in the way that you can in a pandemic. And it is noteworthy how far we've come. And we should all be really proud. And then the way we always said, don't let up. This is our ability to continue in this direction depends on each and every one of us. So stay safe, New Mexico, all together, New Mexico.